Today's webinar is kind of duly sponsored by SADAHO as well as by HealthPOINT. If you want to learn more about our site or our organization, please check us out at healthpoint.dsu.edu. So today's presenter is Holly Ahrens. Holly is our clinical IT manager, and she oversees our team of clinical IT specialists. Holly's diverse background more than qualifies her for today's topic. Before coming to HealthPOINT, she was the Director of Quality Management at the South Dakota Human Services Center, where she was responsible for their health information system, developed and administered facility-wide quality improvement programs, and conducted workflow redesign projects. She was also the Quality Risk Manager, Privacy Officer, supervised the Admissions Department, Patient Services, Medical Records Department, and Utilization Review. And I always get a little bit dumber when I read her intro because I feel so humbled by everything that she's done. Holly's also worked as a researcher for psychiatric clinical trials, was a professor in the HIT program at a community college, and she's worked in various aspects of ambulatory private family practice as a phlebotomist, office manager, medical records clerk, coder, and receptionist. She is certified as a registered health information technician by the American Health Information Management Association and has an associate's degree in applied science and health informatics. So with all that being said, I will turn this presentation over to Holly Ahrens.
Thanks, Jeff, and thanks everyone for being here today. So today we're going to talk about a topic that has many pieces to it, just like this pie, is the EHR project. And we are going to try and tackle it one slice at a time. This webinar is going to be an overview about planning for EHR success, and then future webinars will cover different pieces of this pie so that we can digest it just one slice at a time. So be looking for those information sessions and also webinars that are coming out in regards to the different aspects of this project. Now, let's talk about the first thing that you usually hear with electronic health records is about implementation. You know, we talk about implementation, and that's a very, very small part of an EHR project. It does get a lot of the fanfare. The go-live date is a big milestone in the project, but it is not the entire project. So let's look at an example of the difference between implementation and adoption. So we take a common lawn, and I think most all of us have probably figured out how we can maintain that lawn is buying a lawnmower. So that's the first step. So you purchase that, you know how to use it, maybe you've looked at the instruction manual. The lawn grows, you mow it, you may be a straight line cutting person, or maybe you're going to throw in a diagonal pattern once in a while. But this is definitely just implementation. It's not full adoption at this point. Now this is full adoption. When you fully understand the the capabilities of the lawnmower and you put that to use, you have full adoption. So it is with an EHR. When you begin to meaningfully use and optimize the use of the EHR, you can achieve what this grounds crew did when they fully adopted the lawnmower into their groundskeeping. It's pretty impressive, I think. So a successful EHR project is definitely about adoption versus implementation alone. I think Jeff has a question for us, and I think I'll grab a drink.
All right, so here's a quick poll. If you could just click on the most appropriate answer as far as where your organization is at regarding adoption. Are you in the pre-implementation stages with vendor selection, actual implementation, post-implementation, adoption, or fully adopted? So if each of you could click on the appropriate answer, and then we can just kind of see where everybody's at. And this helps us in terms of how we want to deliver future messages as well. So appreciate any input that you could provide there. It looks like we're a little bit all over the board. I'm going to wait just a little bit longer, make sure everybody is given the chance to submit their answers, and then we'll be able to post the results here in just a sec. Okay. So here's our Here's our results. It looks like it is fairly spread out. 33% are in the vendor selection mode, 17% are the implementation mode, 17% in post-implementation, and 33% in adoption. So thanks for sharing those numbers with us. And I'll turn it back to Holly.
Well, then you can see by those results that it is a unique project for each location. But the common factor is that to be successful, you have to move towards the goal of adoption. That's where you will have the success. So we've seen many times that EHRs have been implemented, and we've seen after time, we've seen many EHRs that have come through and been implemented, and I've also seen that numerous EHR implementations have failed. Why have these failed? Well, there are certain reasons, and a few of them are listed here, and you'll see the major one is stakeholder management. Now that is, stakeholders would be all the staff that are part of the project, the leadership, the line staff, the providers, and this is also the community or your boards, okay? So managing that process and the needs that they have is usually the one reason that the EHR adoptions fail. Also, change management. If you haven't done the planning for or introduced change in a positive manner, then change management issues will come to the top. Also, vendor management. If you don't have one specific person that's responsible for vendor management or that relationship with the vendor, if that is not managed properly, then you will have issues in regards to the vendor. Now, one of the things that I see most often are existing processes just being automated. Now, this becomes a true issue when you get to the point where you have implemented the EHR and you're seeing your staff create workarounds to the EHR. What you've done is you have basically put in a system that just automated broken processes. So the planning up front with workflow redesign helps you to create efficient and effective processes and then using the EHR within those processes. And lastly, culture. Culture is always an integral part of change, and your organizational culture is going to be something that you'll need to assess and find out what opportunities you have to increase that culture and to have a more positive culture. We're going to talk about the majority of these things, and culture will be a main topic that we talk about. Now, I don't want to put in your mind that failure is a word that we want to have out there, but really defining failure is that it's a lack of success. So I don't want it to be negative in any way, but you should have some project expectations with this EHR project and goals that are attached to it. So if you're not achieving those expectations and goals, we do have a lack of success, which is failure. The first aspect of getting to a successful adoption is organizational alignment. Now this links your leadership, your culture, and your processes to organizational success. So like these dominoes, if your organization and its resources are not properly aligned and of one purpose or one focus, some progress can be made, but ultimately your efforts will fall short. Organizational alignment is required to ensure that all the stakeholders understand which direction your facility is moving. So you must ensure that your mission, vision, value statements are clearly placed in front of them. These are not things that you can place on the wall and they collect dust. They have to be in the forefront of your practice. You have to develop expectations or goals. Your communication plan must live through the entirety of your project. You must have clinical input, and you must have physician champions. We're going to discuss each one of these things. Now, for critical access hospitals, you are very unique from other settings. In fact, you have to act as an acute care facility. You have limited IT support. You have a limited patient volume, which then has a more limited revenue stream. And your human resource capital is very limited as well. And usually you've spread a lot of tasks over many positions. Now, because of these constraints, I'm sure that you have a greater sense of urgency to ensure that the organization is aligned so you have no room for waste or inefficiencies. So to ensure that you have organizational alignment, you're going to have to prepare your organization for this transformation. So I'm going to put a definition out there and tell me if you feel that this is you. So the definition of an organization: it is a body that has a membership acting or united for a common purpose. Okay, pretty clear. Are you an organization? I don't know. Some people may feel they are. Some people may say, yeah, some days we are. But that is the definition. They're acting together for a common purpose. So how do you achieve that? You must do the following things. You must create a compelling vision. This vision must inspire people to work not just for themselves, but the good of the organization. It must point towards some commitment for a broader social good. Okay, so it's not the bottom line, and I think we all know in critical access hospitals that is not the usual vision. So you are in a unique position that usually the people that you have in your organizations are there for a common purpose, and then you can build that compelling vision around that, and it's helping others. Start by identifying your core values. And if you've heard me speak before, you know that I am very much about identifying what someone's values are. So you need to do that for your organization. So this is sitting down, looking at your vision, identify your core values, identify the purpose, and how your EHR project will tie to your organizational purpose. And then develop a vision for the future. What will your organization look like once the EHR is adopted? Now, all of these things will need to be able to be communicated to your staff. Probably one of the biggest keys in this whole project is the communication. We continue to assess different types of organizations, critical access hospitals, independent clinics, health system clinics, and we see the same thing coming to the top, and it is communication. So you must be able to communicate all of these things in a very consistent manner. Make it enlivened, make it very entertaining for people. You know, there could be one message, but you can tailor it for different audiences. Okay. The next thing is creating a uniform work processes. What I would recommend that you do is start researching business process management. Now, I'll say that again, business process management. What that is it's the philosophy of getting processes through a modeling process, managing those processes, automating them, and optimizing them. Okay? This is the work that needs to be done ahead of time. It is that workflow redesign. Finding out what can you standardize. Now, I understand you cannot standardize everything, and especially in healthcare, we have some unique situations, but there are standardization opportunities across the organization. Okay. The next major point in organizational alignment is establishing a reward system. And I know this is very difficult with the resources that critical access hospitals have available to them, but it can be a reward system that is non-financial. So develop a system that provides positive reinforcement when someone acts in alignment with the new set of values and beliefs that are being put forward with the EHR project. When everyone starts moving in the same direction, you're going to see that there's going to be more self-awareness, and they will have the ability to self-manage around that common purpose. So really, you're creating a system that kind of decreases the amount of time that you need to manage people. And I know I've been in management for quite a while, but I definitely have seen the workings of a reward system, because then it allows them to self-manage, and I can then lead, which is the ultimate goal, is to be able to be in leadership and you lead people versus managing them. Okay, now culture. I think we all recognize Southwest.com. This company is well known for their culture. I think we've seen it in their commercials. They are a team with a mission to improve air travel. Very strong employee involvement. I think in their commercials they see these are actually Southwest employees. They are succeeding with this. Are you succeeding in your culture? when you're looking into a culture, some of the factors that you need to assess is your ability to access your stakeholders' input. Can you get people to talk to you about what is going on? How do you manage the conflict that occurs in your organizations? And I don't believe that there's any organization out there that doesn't have conflict. Are things getting resolved? It's one of the questions that we ask in our assessment is how are conflicts resolved? And we've heard things from leadership has a definite formal process that we go through, a grievance process, to the point where nothing gets resolved. Things just fester. Things boil up and then we have to revisit them. So make sure you know how you resolve conflict. How do you communicate? How do you conduct planning and project success, and how is that communicated to people? Another aspect of culture is allowing people to work to the top of their ability, their training, their certifications, or their licensure. This is crucial. People have gone and gotten training for a purpose. They want to use it. Now, this is one of my favorite things is, you know, if you have a culture that is very aligned with your mission and vision, it should always reflect that in their day-to-day activities. So I think you can steal this from me, but if your culture is aligned, it reflects the vision, mission, and values of your organization in its day-to-day activities. So any patient, client could walk in and see any aspect of your organization and say, wow, they really value their patients. Their patients are their priority. They would see it in the smallest of details. Now, one of the major things that we are hearing from critical access hospitals, from clinics, is acceptance. Also in that is engagement. You know, we can force people to do things at some levels, but really to avoid failure, you need to seek out others to get to their acceptance and engagement of your EHR and its new processes. So lack of user acceptance is #1 cause in the failure in this arena, and that is in that stakeholder management arena. Unfortunately, time was not taken to understand each user and their abilities with technology. Now, during our assessment, we will be looking at users' computer proficiency, their computer anxiety levels, their development of personal goals for achieving top efficiencies. When you don't have people looking at their own performance, you will never get to that point of self-management or self-ability awareness. So set up goals that are included in their performance evaluations. This allows the user to track their own progress and how they're doing in the new EHR project. It really builds that ownership of the project. This is also where you could include that reward system. So once they start achieving proficiency goals within their user role, you could implement some of those rewards to help engage them and build that self-awareness and ownership. Another factor of success is clinical input. Not sure how many times I'm going to hear this through assessment, but physicians and providers are saying that they were not included in the planning or in the required documentation needs or the fields that are in the EHR that are being utilized. And this is something that we have to rectify. And you know, the EHR is a strong clinical tool. It makes sense that as you progress, you get clinical input. And this should be from the beginning of the project to the end of the project. The EHR project should not be viewed as an IT project alone. It's an organizational project. So you can't be successful by getting input from only one aspect of your organization. Your project manager should always identify the stakeholders in the project before you even start. Determine the level of impact each stakeholder will have, their level of barrier to change, and then begin discussions with those stakeholders to decrease those barriers and open up the lines of communication. This again will help build ownership of the project. Clinicians are data and quality driven people. They currently are probably not included in your quality planning processes or your quality programs, but it's time that you bring them into the fold of quality improvement. You need to start assessing what they do in a day-to-day basis. Start asking them the questions. Who collects the information that they need? What's collected? Where is it stored? When do they complete that documentation? How is it going to look when it's electronic? When you bring those clinical staff to the table to discuss their documentation, this really shows them that you're engaged with them and you want to know their input. It shows them you're beginning to understand their scope of work and how much impact the EHR is going to have on them. Now, we started talking about this planning process, and this is all about planning, the project plan, project management. This is where you're going to need someone set up in a role that will help with planning. An EHR project, like I said, is not an IT project alone. It's about people, processes, and technology. They're all very important, and they all require attention. So just like our cheesecake, the project plan needs to break things down into bite-sized pieces. It needs to assign work, track goals and objectives, move the project along, hold the project back when that's required, and ultimately that project manager is responsible for the project. Now, this is no small task and takes unique individuals to accomplish project management. Now, an EHR project should not be heaped on top of an individual that is already wearing several hats. Now, I know in critical access hospitals this is hard to do, but it takes planning to look at the people aspect of this. You will need to reallocate some time when you select a project manager. So it may be looking at tasks that maybe could be put off until after this project has been started. You may have to write a project list and see what priorities the projects have, and some may have to take a back seat to the EHR. But I can tell you, when you invest in a good project manager, they can walk into any industry. If they know the mission and vision and goal and objectives of the project that they've been given, they can move projects forward and lead people. All right, Jeff has another poll for us.
Okay, so just shaping off of what Holly just mentioned about project managers, looking to see for those who are doing your plans, have you actually already identified a project manager or not? Good, we're getting a quick response on this one. So I'm going to go ahead and close the poll and then let everybody take a look at the results there. So 71% have identified a project manager, so that's a great first start.
Did you say 71%, Jeff?
71%, correct.
Wow, that's excellent. I'm very impressed with that, and that gives me, some hope that you guys really understand this topic. So I'm going to move into some of the things that I think a project manager will be doing for you right away, or they should be doing for you when you get into the project plan. Now, they should be assessing, and we've kind of talked about this, the stakeholder assessment and finding what their impact is. And just like this little furry guy, it's a smart tactic to always assess your surroundings. So how do you know where to go next if you're not fully aware of your capabilities and your capacities in your organization? So your assessment is going to look at your current state of your facility. Now at HealthPOINT, our assessments are based on the organizational alignment category, management capacity, operational capacity, and technical capacity. And then through a rating system, we identify areas that need to be addressed immediately and those that can be addressed further along in the project life cycle. Now, when you have assessments, you should always have them feed into some type of roadmap or timeline that has measurable goals and objectives. Let's talk about our current setup that we have for assessments. And organizational alignment, we talked about that. What we're looking at here is some of the things we talked about: communication, culture, conflict resolution, leadership involvement, physician leadership involvement. Now, the expectations must be communicated from leadership. You must be able to outline goals and objectives for the project. And this is one area that I see a lot of people missing. So I want to just reiterate that you must have goals and objectives for these projects. And then also have the communication tied to the organizational alignment, and also your champions. Make sure that your physician champion is well respected by a cross-section of the facility. They need to be an opinion leader about the topic, must be accessible to the majority of the stakeholders, and they must be able to dedicate time to this project. Engaging your physicians through your physician champion is going to be an asset for you. Next, we look at management capacity. Now, once leadership has decided on your course, you have to understand if your management skills are available and if your managers are ready. Now, your managers should be able to set priorities for their staff. And sometimes Michael from the office, he lacks some management capacity to lead his staff towards a common purpose successfully. So during this time, we're assessing the ability of their managers in a current position in terms of their knowledge of EHRs, their ability to lead people, and the time that they're able to dedicate to the project, the staff that they have available to them, and if they have the ability to reallocate time for this project. Now, your operational capacity. This is where you would look at your current projects, resort or suspend those projects. This is where you're going to be making your stop doing list, which is very exciting for staff, is where they say, you know what, we get to stop doing certain things because we're going to have an EHR in place. Okay? Now, I know that projects and stop doing lists are very exciting, but you have to be prepared for some of the backlash, especially in critical access hospitals, because you may have physical plant projects going on. You may have new x-ray equipment being installed. Now, you'll have to prioritize the EHR with those projects as well. Also, in operational capacity, we'll be looking at your financial capacity. Now, most facilities have IT as a line item in their budgets, but some do not. My suggestion to you is that to look at your future planning for budgeting for IT must be a line item. You must make sure that you have a communication plan tied to that line item, training plans, and any capital asset purchases that you may need to make in the future. The last part of our assessment is technical capacity. So adopting an EHR means that the tools that you have, you must be able to work with the requirements of an EHR. So this is where we get pretty concrete in our assessment. We're going to be looking at the capabilities of your current IT structure, things like computers, printers, physical layout, networking, service, wireless strength, bandwidth, all those great things. The ability to adopt an EHR is going to rely heavily on your infrastructure, because I think we all know if your system goes down at 3 o'clock at change of shift and heavy users are signing on, this system will not be adopted because they don't have confidence in the system that it's reliable. The next part of this is security and analysis, a very important part of both meaningful use and HIPAA regulation compliance. You must conduct these on a regular basis. If you find deficiencies, you must have an action plan and follow up on that plan. Planning must include the IT staff. Like we said, you cannot have impact by input from just one aspect of your organization. They must be included in the planning. They will help you understand the requirements of the software that you're looking at and the hardware needs. What is the reality of your physical location? Can you even have computers in exam rooms? Or are you going to need laptops? Or are you going to need something, iPads or PDAs? These people are the reality checks for most of us. All right, another poll.
Okay, so now that Holly's kind of covered a lot of these topics, if you could check off, I believe this is a multiple choice here. So what barriers have you encountered or expect to encounter as you move forward with your EHR? And your choices are shown there. Lack of planning, if your culture is not change ready, lack of clinical input, user acceptance, or organizational alignment. So we'll take just a few more seconds here to give everybody a chance to put their votes in. And I'm going to probably read these off the way that we've got this set up. Holly's not able to actually see those results. So when they come in, I'll be able to read those off. So it looks like we do have some multiple barriers for the responses we're seeing so far. These are all confidential, by the way, so don't worry or be shy about submitting your answer in. Give a few more seconds here. Okay, great. Everybody's put their input in, and here are the results. So we ended up having 43% saw lack of planning as a barrier, 29% culture not change ready, 43% lack of clinical input, 43% lack of user acceptance. But it looks like the king is the top barrier at 57% is a lack of organizational alignment. So, all right, Holly, I'll turn it back to you.
Thanks. Well, and I'm not surprised by that, and that's why these topics are things that we really feel are important to your organization. Now, I definitely heard the 57% of organizational alignment and also the 43% about acceptance. This topic of acceptance can translate to all levels of staff. So I'd really like to go through this in a more detailed fashion. I talked on it just a little bit through organizational alignment, but it is one of those things where this is where you engage people, and it's at all levels. So why do you have to do this? Well, this is where you really put the investment in your people and knowing that they really will push this forward or they will hold it back. So I hear anecdotally a lot of times that people think the acceptance of computers is based on an age factor or a professional level or a gender factor. Now, I'm kind of a skeptic sometimes. Some may even call me jaded, but I don't believe that any of these factors are the one sole reason that people don't show user acceptance of new technology. I believe that the person wasn't engaged in a way that allowed them to build confidence with the change and then establish their ownership of the change. Now, engagement is the first step in user adoption, so let's talk about that engagement. We must make sure that we begin to engage someone and help them see that common purpose. And I think you'll remember from the beginning discussions that if you show that vision of the common purpose, that people begin to move towards that in one direction, okay? So this is what we want to do, develop that common purpose. I think everybody recognizes the pink ribbon. That is a purpose that everybody understands, okay? Now, some of the things that you can think about for success and helping people understand are the benefits of an EHR, okay? 3 of the top benefits of an EHR that are very evident are their impact on quality improvement. EHRs collect an exorbitant amount of data. That data should be used in a way that can improve the practice that you, the provider practices, and also help you in decision making with that data. The next is the ability to track chronically ill patients. This is another benefit of EHRs. And then also for workflow efficiencies. Now, one of those things could be your common purpose that you identify. Okay, so those are some examples. Now, communicating this and having everyone stand behind it is your goal. So let's talk about physicians, and we talked a little bit about them, and let's talk about their ability to accept technology in their practices, okay? What I hear is that there's varying levels of acceptance, but most often providers, there's a very low acceptance rate. All right, find the common purpose for providers. Understand who they are. Like we said, they're data collectors. They use data to diagnose problems. They're very observant. They utilize information that they have collected through both observation and from actually what the patient is telling them. So they've taken that information to treat a problem. They provide techniques to prevent that problem in the future based on their knowledge. They're very focused on patient outcomes. They want to know how that medication worked. Was there any side effects? No side effects? They also want to decrease wasted time. I think you'll find that any provider does not like their time wasted. They want to be able to use their skills to treat as many patients as possible and do that well. They rely on information that's current and collaborative. They want to know their patients holistically. Now, if you look at those purposes that physicians have and align that with your project for an EHR, this is something you can capitalize on. I would be hard-pressed to find a physician who couldn't align their values or their purpose for treating patients with those three things that we had talked about that EHRs have. Quality improvement, so quality of care. Tracking chronically ill patients. This is something they're interested in. And then also efficiencies, decreasing the waste in the time that they spend treating patients or doing paperwork. Okay, so use that, capitalize on it. Now, determining what their values are. This is a little harder, and this is where some people kind of glaze over when I talk about it. Find out what they value, okay? And this would be from professional providers, this would be secretaries, receptionists, medical records people. Find out what is it. Whether it's bananas or recognition, you must know what they value. The next part of that is restructuring their values to align with the EHR project. So once you find out what they value, find out what was within your EHR project that aligns with that. Okay? People will come to the realization that the EHR does have benefits, but you must show the value that it's going to have directly to them. Once you do that, and you've kind of walked them hand in hand up to that point, they will make that self-realization that this EHR project has value. Once you've established that alignment with their purpose and the project purpose, and they've realized that the project is within their value system, then you start setting the goals for them, okay, so they can start seeing success. Make them personal, okay, tie it to their particular tasks, and it shows them the common purpose and the ownership that they can have of this project. Now, within each of us lies courage to overcome tough times. So now, no doubt, adopting an EHR is going to be worthwhile but very challenging. So you're going to have to provide a lot of support to people during this engagement. You must be able to provide some type of reward system that we talked about. And if you find out that an employee really values certain things about their family, or if they value helping other people or donations to charity, again, capitalize on that. Have courage to step out and say, we can do something creative, and it doesn't have to be financial. Next, your organizational style must be very evident, okay? So if you, these pictures are great. It shows a side of leadership that sometimes we don't see. You can see in these pictures that President Obama understands this concept. So use your style, like in the bottom picture. Now, the president knows that to fist bump a kid is really appropriate at this time, and if he did a handshake with this child, that would probably make the child feel a little awkward. And then also having fun with your staff. It's really important. You can see in the top picture, you see the president placing a foot on the scale of one of his aides. Now, at my house, that would probably cause hysteria and crying, but in this setting of friendly competition, it's good humor, and it puts people at ease, and it lightens the mood. So don't be afraid when you're engaging people to use some style. Now, Jeff's going to talk to you about some of the membership that we have here at HealthPOINT.
All right, thanks, Holly. Well, we're not going to sell you any American Express credit cards or anything along those lines, but we do definitely want to say that establishing a partnership or membership with HealthPOINT definitely does have its privileges, and especially as a critical access hospital with limited resources, there are definite advantages. There are many concerns while developing your plan for EHR, so we want to start helping on the financial front. So Holly, if you want to go to the next slide. One of the things that we've put together, especially for critical access hospitals and rural hospitals, is a graduated fee scale. So one of the things that we've done here, based kind of on a 4-year plan, is this fee. So regardless of how many EHR users you have in your facility, we've put a cap on our fees, and we'll get to that in just a second. But you'll never have to worry about paying for more than 25 of your members. So if you have, let's say, 50 employees in your facility, and maybe 35 of them are actual EHR users, and we can work with you to define what that actually means. Even if you did have 35, then there would never be a fee of more than $50, never a fee that's going to encompass more than 25 of those users. So, for example, in the first year of establishing a partnership with HealthPOINT, 50 times 25 is right at $1,250. It's a very, very low fee. So, Holly, if you want to go to the next slide. So the second year then is a partnership with HealthPOINT would be $100, and Holly, you can go ahead and click on to the next two. Then we go on to $150 for the third year, and then $300 for the fourth year. And that $300 fee per EHR user is what our typical rate is for our priority members. And I guess we just really want to stress the importance and mission that we feel behind encouraging critical access hospitals to get going, and we want to make it as easy as possible for you. So that's why we've developed this special graduated fee schedule for your benefit. So let's go on to the next slide, Holly. So we've talked a lot about some of these details and all like that. So the question is, so we're going to be paying these fees. So what's behind the curtain? So let's talk about those next pieces. Holly spent a lot of time talking about the assessment. And Holly, if you want to go ahead and click over. One of the things that our clinical IT team does, led by Holly, is they get in and start to do an assessment, and that would include really taking a good long look at the organization and talking with its various members, clinical staff, administration, physicians, nurses, you name it, and taking a look at the current workflow, and then also doing some analysis on change management. Once that assessment is put together, then that will feed into a developed roadmap that's customized for your location, which will enable you to get a little bit closer to obtaining meaningful use. And then in addition to that, then we would also work with you to develop proprietary tools for your organization. So some of those items that we would design for you would include communication plans, any additional change management that may be needed, as well as project plan templates. And we're just kind of getting started here with some of the services that we would be able to provide. Holly, if you want to go into the next slide. Another thing that we do as a division of Dakota State University is we also offer workforce training discounts. So we have health information management courses, health information technology courses. People would participate with these. Most of these courses are online, and we can offer major discounts on making sure that your staff members, or maybe just a few, maybe it could be quite a few, would be able to get into these courses and learn a little bit more about health information technology. And again, we would be able to provide a variety of discounts and then also vouchers for interested individuals within your organization once you would become a partner with HealthPOINT. And then, so let's talk a little bit more then about those discounted services that I was talking about before. So we have a graduated annual fee, and then once the hours once the assessment phase is done and we get into a period of time down the road, then we would be offering 160 hours of consulting at only $10 an hour. And then once those 160 hours are used up, then there would be unlimited services that we would provide at $80 an hour. So we want to provide as many discounts as possible. Again, we've put together a fairly aggressive plan to make sure that it is affordable for all on this call, and try to get things going for you. All right. Let me get to my next notes here. So between the webinars that we'll have both today and then next week, and then in the time to come, again, this particular webinar is critical access hospital specific. So we've kind of throwing in some information that's very specific for you all. But we just bear in mind that EHR adoption is a multifaceted and it's a complex project. As Holly stated before, it involves people, process, and technology. And we're really attempting to scratch the surface today to demonstrate how HealthPOINT can help you achieve meaningful use and how to improve your organization's EHR initiative. But again, it's been a pleasure. Thanks, Holly, for spending your time with us as well. Everybody have a great day, stay warm, and drive safe.